Today in the series of Docplexus KOL interviews, we have with us Dr. Sunil Abraham, who is working with the Department of Family Medicine at Christian Medical College, Vellore. He has an experience of nearly 3 decades and has been actively working in the rural areas of Tamil Nadu and Kerala. Thank you, Dr. Abraham, for interviewing with us.
Thank you. Good morning. Thank you. It's a joy to be here.
Sir, can you tell us about how we can raise awareness among the medical aspirants on family medicine?
Sure. I think there are 3 stakeholders who need to do this. One is, of course, the family medicine specialists themselves, and they have been doing it. The Academy of Family Physicians of India have been trying to make the public aware of what family medicine is through conferences, through programs on TV and radio. So that's been going on. But I personally feel there are 2 other important stakeholders. One is the public, the citizens of the country. If you look at how family medicine developed in countries like the US, it was a response to the demand from the public because people were fed up with the depersonalization of medicine and the fragmentation of medicine. The doctor-patient relationship was disappearing. And you had specialists for your eye, for your ear, for your nose, for your throat. But the question came, who is your doctor? And that demand came, and that's how family medicine came up in countries like the US maybe 50, 60 years ago. So I think we are reaching that stage in India now. There is this lack of trust between doctors and patients and the public. And people are asking, whom can I trust? Who is the personal physician I can trust? So the demand should come from the public. And one thing that we have discussed recently is to have discussions between the AFPI and citizens and tell them, look, this doesn't have to go on like this. You all need a personal physician who will not just treat your diseases, but will keep you healthy, because that's what life is about. It's not about episodic, you get a headache, you treat this. You get a fracture, you treat that, which is what, unfortunately, medicine has come to now. But you need someone who will look at you and say, I will manage your health. I will keep you healthy. It's like me, I take my car to a workshop. I don't know how the car works. But if I only have a workshop person who says, you got an oil problem, I fix it. But who doesn't tell me, look, you got something else coming up in 1 month, please bring back for a checkup. I would like that kind of a workshop manager. And that's the kind of doctors we need. So the first one, the stakeholder should be the public. So people should demand that we need personal physicians. The other one is the government itself. Like we had a fantastic presentation about the new Prime Minister's Ayushman initiative. And it's got everything in place. But there is a crucial link that is missing. The cornerstone of that program should be a multi-competent specialist who is the family physician. So you cannot have single subject specialists going to a primary health center or a community health center. You need people who can manage multiple things and would also be responsible for a defined population, which is exactly what family medicine does. So I feel these 2 people should be sensitized and say, here are your problems and here is the answer. And they should demand for it.
So, do you also think that we need to integrate family medicine into other specialities?
Absolutely. Integration in the sense other specialists should know what is their role and what is the role of the family physician. Most of medicine is practiced in hospitals. But what happens after that? And what can be done to prevent that? So if somebody is admitted with a myocardial infarction, we have fantastic cardiologists who will do the angioplasty or whatever and then discharge them. But who is the doctor who is going to tell them, look, this is what happened to you? Because many patients don't know what happened to me. These are the medicines you should be taking. These are the lifestyle changes you should be making. You need to stop smoking. And the patient will have questions. When can I go back to walking? When can I go back to work? Am I at risk of another heart attack? What can you do to prevent that? So they need to work with the family physicians. Unfortunately, we don't have this as part of our curriculum. So that change should be made so that the single subject specialist will know there are other specialists who are part of this team and he will look after them and they will send them back when there is a need. I had a chat with the nephrologist in CMC Vellore who said, of the 53 patients I saw, only 15 needed to see a nephrologist. The others can be managed by the family medicine specialist. He said, I'm wasting my time. So the specialists can be aware that there can be guidelines and they need to see only those patients who need their expertise. So it has to be brought into their training also.
So you talk about syllabus and how all this can be incorporated in it. Do you think our current syllabus is outdated?
So when you think about syllabus, the medical council is actually doing quite a bit about it. They are moving into what's called competency-based syllabus. So going away from just having knowledge, the medical council is making changes so that it comes to application of knowledge and learning concepts. So CMC Vellore is nodal center for faculty development, and I attended one of the sessions recently. And what the medical council is doing is really fantastic. They're bringing changes in the way teaching is happening, in the way students should be trained, etc. With regard to family medicine, again, the MD family medicine curriculum was not available for a long time, but recently they have put it up on their website. It still needs a little bit of fine tuning, but it's really up there now. And the MCA did ask medical colleges to, they're encouraging them to start family medicine. The government of India in 2010 wrote to all the state governments asking them to start MD in family medicine. So there is a bit of a move happening there. But the other issue is not about the syllabus, but how do you update in your knowledge and skills? I think that's an ongoing process. That's where there's importance of CMEs and continuing professional development that's needed.
Also, do you think online community of doctors, exclusive communities for modern practitioners of medicine, they would help to raise awareness about on family medicine and how we can make it reach to the doctors at the last mile?
Absolutely. With the mobile phone and the internet, it will certainly reach there. But it should be part of a bigger package. It should not be just about these issues, but absolutely, it can be a tool to spread the message and to reach people. But one of the things which could be an online pack is, for example, I get every few other days updates from McMaster University in Canada on what is the latest research findings, which will impact family medicine. So they'll look at all the studies and they'll do, this is a publication which came yesterday, and how is it going to affect your practice today, which is really useful. So if you could incorporate that so that for the busy clinician, for example, in Australia, they got something called 6 minutes. It's something I get from there. 6 minutes only it takes, but it tells you something that's happening in your area of specialty. So you have these things coming every few days, and I know that I'm up to date because I may not have time to read a whole article. But if I get an abstract and what it means, it'll certainly make a difference.
Thank you, Dr. Abraham. It was a wonderful discussion.
Thank you very much for it.